Good afternoon, everyone. Will Dupree here in the KXAN live studio. We're about to carry a press conference live that's coming from Austin and Travis County leaders talking about the surge capacity for additional COVID-19 patients. Let's take a listen.
We have a total of 554 confirmed cases with 77 hospitalized and 28 individuals on ventilators in our system. We are going to continue to update you on these numbers and provide this information on a regular basis through our COVID-19 website. Today, Mayor Adler is going to talk about our new modeling data from the University of Texas through the work of Dr. Lauren Ansel Myers and her team at the University of Texas. We have looked at this model. We've looked at other models. I'm sure everyone's aware that there are a number of different models showing different things out there. But we're going to talk about our local model as it is taking into consideration not only national and global data, but actually what we're seeing here in the city of Austin and Travis County as it relates to hospitalization, infection rates, as well as the mitigation steps that we're taking to flatten the curve. I also want to talk to you a little bit about our surge plans. You've all heard these terms before, and I want to get a bit more specific on what I mean when I talk about surge. When we talk about surge, there are three different stages of that surge process. Stage one is the hospitals themselves increasing capacity within the walls. That may be putting 2 beds in a room that normally has 1 bed, where we can take care of 2 COVID-19 patients. It may be turning anesthesia machines into ventilators, so not working in the ER, but utilizing it for those COVID-19 patients who need additional ventilators. That increase alone gets us to about 4,300 beds within our current hospital system. The next phase is what we call a Type 2 facility. These are facilities, and we've identified at least 6 of those so far, where we can put additional patients who need to be hospitalized. This may be facilities that are normally outpatient surgical centers. They may be facilities that used to be hospitals, and there's a number of other types of facilities that we're looking at and reviewing for that Type 2 facility, which is that second stage of the surge plan. This is an ongoing process. We have a whole team that's involved in evaluating those sites, looking at the logistics associated with that, as well as the personnel and equipment that would be needed to transition those sites. Finally, the third phase or third stage of that surge plan is what we call Type 1 facilities. These are large venues, large areas that can be converted to look after 100 or 1,000 patients and have the ability to scale up as needed. We have identified one site, and once that site is identified, we will disclose that publicly, as well as some details regarding the capacity of that facility. That assessment's involved healthcare providers, our first responders, logistics experts, as well as various state departments who are involved in both helping secure those sites as well as providing equipment and staff for those facilities. I also want to mention something else. This is Holy Week for a lot of us. And I know that's stressful for people. I know they want to be in church. They want to be with their families during this important week. But now's not the time to do that. I know it's different. My family and I went to Palm Sunday Mass in the evening on our couch at home. It's different. It's not the same. This weekend, Easter Sunday is going to be much different than it normally is. But it needs to be different. It is dangerous for us to go back to churches right now. It's dangerous for us to have large family gatherings where we're bringing in multiple generations of families together. We have already seen the devastating impact that these kind of decisions can have on families in other jurisdictions that are fighting this battle along with us. So I can't stress enough the importance to maintain that social distancing. And if we can all work together, then we can have many more celebrations together once again. But now we have to be different. The final thing I want to mention is that it's important for everyone to understand that while most of these cases of COVID-19 are mild, it is critical that you not wait when it gets worse. If you are at home and you're taking care of yourself or a family member is taking care of you, it's critical that you seek out health care. If that's going to the emergency room, if it's calling 911, I want you to worry about getting better, not about the bills or the logistics associated with having to be hospitalized. It is critical for you to get that help now. I'm also going to just mention one other thing. We do have 2 other types of facilities that are already in place. That is something called the ISOFAC, or isolation facility, where we can put COVID-19 individuals so that they can recover without having to worry about infecting their family members. This facility is a hotel. It's available to anybody who tests positive for COVID-19 if they don't want to be at home during that illness process. The more people we can get to move to these facilities, and they're comfortable facilities, the better chance we have of decreasing the risk of infection in the household. We also have a facility called a protective lodge, or a pro lodge. And these facilities are designed for folks who are at high risk for complications. These may be individuals experiencing homelessness or other individuals who need a safe place to go to be away from other people who may infect them and help prevent that significant course of disease in those individuals. So again, these resources are available. Individuals who need that help can go through our APH website to access those facilities, and we have links online also for a healthcare community who need to access those facilities. I'm going to turn this over now to Judge Eckhart, who's going to speak on a few items, followed by Mayor Adler.
Thank you so much, Dr. Escott. Oh, I'm still working through the whole masking circumstance, so my apologies. And a big shout out to my cousin Denise De La Garza for making this beautiful mask. I want to thank the community for achieving what looks like a 64% reduction in our non-essential activity in Travis County. That is really profound, and it really goes to the heart of who we are as a county. But I think that we could do even better. If you would like to take a look at 3 different websites to monitor our behavior and see how we might be able to do better individually and collectively, I would suggest Cubic, C-U-E-B-I-Q, also Unicast, U-N-A-C-A-S-T, as well as Google. Google also has a wonderful platform, and we can make all 3 of these websites available to you. The modeled projections that Mayor Adler will be speaking on momentarily from the University of Texas, and that Dr. Escott mentioned in his remarks, shows multiple possible futures for us. Nothing is certain in these uncertain times. But what the 3 websites I just mentioned tell you, along with the modeling that University of Texas has done for us, is that stay home, work safe is beginning to work. We are seeing a significant reduction in our activity, and it's beginning to show in our doubling rate as well as in our overall numbers of cases against our projected rate. So we might be at the 50th percentile future, and Mayor Adler will tell you about that. But we might be at the 75th percentile future, which is far brighter. And then the 90th percentile future, which is much brighter still. But in every instance, COVID-19 remains a threat to our community that's going to require all of our collective efforts to address. So the governor has issued orders that last through this month, and the mayor, surrounding county judges, and myself are working along with our medical professionals, our hospitals, as well as the private sector to take a look at what Stay Home, Work Safe 2.0 should look like, so that we can find the right balance between our health and safety and our economic health and safety. So I do want to commend our tremendous Emergency Operations Center and our combined public health organism for coming up with a surge plan that plans to the 50th percentile future, because it would be far better to be over-prepared in this circumstance. We have the surge plan, We also have increased test capacity in our community. Not enough yet, but it has been significantly increased. We also have a task force looking at protective gear. As you can see, we're wearing masks in here when we're close to one another. And we're looking at ways to get more protective wear for our medical professionals, but also for people on the front lines, whether they are driving a bus, working at a grocery store, or working on a construction site. Again, it will take our combined efforts, both government and private sector, to make sure that we have elevated standards of safety as we learn how to work safe in this time of COVID-19. We're also seeing all kinds of local innovation, which I am so proud of. From the homemade masks that are not only innovative, but showing us a little bit of a bright spot in our day, to hand sanitizer being made by some of our local distilleries, even to innovations on how to produce or retool machinery for ventilators. There's just a tremendous amount of innovation and community spirit coming forward. We're working with nursing homes to keep our most vulnerable seniors safe. We're working with government employees and essential businesses for ways that we can work safe into the future that will have dividend even past COVID-19. So let's keep staying home and working safe. Let's stay the course. We are saving lives. The life you save may not be anyone you know, but it's far better for us to over-prepare and be able to hug that person sometime in the future than the alternative. Mayor Adler?
You know, I know this is hard as we do this physical separation. People are locked up in home. We're not seeing our friends. This is hard. Make sure that you're calling people that are alone. Make sure that you're doing more than just texting. But we can get through this together. We are getting it through together. And as the judge was saying, the work we're doing right now is pretty impressive. We can do better, and we need to, and that's what I want to talk about in my part presentation here. So we do modeling, and we take a look at the number of reported cases we have in the city. We take confirmations. We take a look at hospitalizations. We can take a look at when the symptoms became apparent for the very first time. But the numbers I'm going to talk about today are based on hospitalizations. You know, the more people that we test, the more confirmations we're going to get. So we could actually be slowing down the rate of the transmission of the virus, but still see confirmed cases go up because we're just testing more people, and we are. But hospitalizations might be a good number to take a look at, because no matter how many people we're testing or how fast that's coming, hospitalizations tell us when the virus is coming to people and making them not feel well, to the extent that they have to go to a hospital. So let's pull up the first chart that we have here. If we could, there it is. This is a chart that came out of the University of Texas study that was just done. And you can see along the bottom are dates. These charts, by the way, are not exact. Modelers are making their best projections based on the data that they've seen. The left-hand side are the number of cumulative hospitalizations that we have in the city, and you can see that pink line shows us what happens if we just closed schools and did nothing else. The first blue line we see with 50% reduction above it tells you where we're going to be at what time, assuming we're only able to achieve a 50% reduction in that physical spacing that we have. And you can see that the peak in Austin really starts, we're going to start feeling it under this scenario, the end of April into May. The actual peak itself probably won't be until May going into June. So while we read in the newspaper about this being the Pearl Harbor week, and that's probably true for New York, but it's not true for here. And as we go across the country, it's going to be rolling with different cities seeing different peaks at different points in time. But there's what Austin looks like for you. We're projecting at this point at a 50% reduction. We're going to start seeing dramatically increased hospitalizations beginning the end of April into May. But if we can do better, if we can get to the 75% reduction that the judge was just talking about, or 80% reduction or 90% reduction, you can see two things. The first is that the peak is much lower, and the second that it's pushed back in time, so we have more time to be able to get ready, to prepare, to build out the surge planning that the judge is talking about. You can see what our capacity is. It's probably a little under 5,000 hospital beds. And if we can stay in this 80 to 90, 95% reduction area, we have all the capacity we need without any surge efforts. 75%, we're going to be needing to surge a little bit, but that's much better than 50%. But that's what we're trying to do. All right, so we now are beginning to have numbers that are coming into us. When you look at the numbers that are coming into us and you look at our history, the first thing you need to keep in mind is what we're seeing in the numbers today reflect what we did in the community 2 weeks ago. Because someone who became infected 2 weeks ago has, 5 to 7 days for it to incubate and to manifest itself. And then it takes a week for a person to have those symptoms grow to the place where they would go into a hospital. So the numbers that we're seeing now that are shown on this chart, and this also came out of the UT professor's report, show you our numbers. And you can see at the beginning, the numbers were to the left of the lines that we drew, and the more recent numbers are to the right. But these numbers still don't reflect. The last number that you can see that we have on here is in the end of March time frame. Our numbers still don't reflect what we have been doing for the conduct that we had when we began to physically isolate. So we're going to be watching this chart over the next 10 days to 2 weeks, and then we'll see really how we've done in the community. But the signals are that we're doing a good job. But I'll tell you, there's some things we need to focus on if we're going to do it well, and that's where we are presented with risks. The judge talked about nursing homes and the work that we're doing to help make sure that those vulnerable populations are isolated at the first sign of any kind of infection. A lot of effort being spent with the homeless community that we have in the city, because the people experiencing homelessness in our town are also vulnerable. And so we have an isolation facility that we can move people to. We already have moved some people that have shown to be positive, so that they can be isolated the same way the rest of the population isolates. We have a lot of capacity in hotels that we have leased or purchased just for this purpose in order to have a place for people to go. But I'll tell you, another place that I'm concerned about are the people that I see bunching up together on the trails when they're running, or the people in the parks. It's important that we close down the parks and trails this weekend. Quite frankly, I think we need to consider closing them down at the end of that period as well, so that we really do show the discipline that we need to show in this community. And then the last thing I want to talk about is construction activity, because that's another potential challenge for us. You'll recall that the county judge and I, in our initial orders, put a limit on the amount of construction activity that would occur in our city. The governor issued a statewide plan, and I want to compliment the governor for that. We needed a statewide plan that's going to make us all healthier, and I'm happy we're doing a shelter or stay-at-home policy statewide. But one of the things that he did do is he allowed construction to proceed. I want you to look at this chart. If you look at this chart, there are 5 groupings. The groupings on the 4 on the right have 3 bars each. The one on the left only has 1 bar. That shows you what the cumulative hospitalizations are expected by mid-August in our city if no one was working construction. You can see it's a little over 10,000 hospitalizations. If you go over to the right, if 100% of the construction facilities are open in our city, if 100% are open, and if we're doing a really good job otherwise of 90, 95% physical separation, then something like construction that might be a hole in that dike becomes that much more important because the rest of us are doing so well in the rest of our lives. But what you can see here is there are 3 bar graphs, low, medium, and high. That's the amount of risk that those workers are facing on the construction sites. So if there's low risk, if construction sites are doing all the mitigation that they can reasonably do, you can see that the number of hospitalizations is about the same even with construction as they would be if we didn't have construction. But that's dependent.
Will Dupree here in the KXAN live studio. We have appeared to have an interrupted feed coming in from the city of Austin at this particular news conference. As you can see, the video stuck there on this particular screen looking at construction activity and the risk for that to continue at this point for people to contract COVID-19. We are checking right now to see if that feed will come back to us. It's unclear what happened exactly, but this again was coming from the city of Austin as they were doing this press conference here a moment ago. As we await for that potentially to come back, and the audio may jolt in front of me and carry that and kind of bury my voice, I just want to be able to reiterate some of the things that they've said here just a moment ago. Okay, it appears that that feed is perhaps lost for good at this point. Sorry about that, everybody. For if you are watching to see the rest of that press conference, I'm unsure what the issue exactly is, so we'll check on that and make sure that if future press conferences are taken, that will not be a problem. Okay, so to kind of revisit and recollect what they were talking about from the city in Travis County, let's just go with this really quickly. So I'm going to pull up this number very fast that shows the number of cases here in Travis County, and I'm going to add some information to that as we're talking too, because this is pretty interesting that they were able to share some bit of more information than what we've had in the past. We're going with on the fly here because this is a bit of an issue. Okay, so this information I'm about to share with you is what Dr. Mark Escott, the Interim Health Authority for Austin Travis County, just shared a few moments ago. If you take a look, this is the latest number of cases here in our area. 554 confirmed cases, 7 deaths, 77 people have been hospitalized, and that final number there says 28 people are on ventilators. As we take a look at those numbers, it appears that we'll be able to carry that press conference once again from the city here in just a moment as we wait for that source to be routed into my room right here so that you all can carry it.
For use. So we're looking
Here we
for
go.
other
Take a listen.
options. We have a great partnership with the Travis County Medical Society, who is working on assessing volunteer capability for physicians who work in other parts of the community outside of a hospital, so private practices, private surgical centers, those types of places. We'll also utilize outside nursing staff that may not be hospital-based that can help us, in addition to our first responders, our paramedics and our EMTs that are both in the city of Austin as well as in Travis County to help supplement those resources.
Great, thank you, Dr. Escott. Now a question from KXAN. Can you name any of the Type 2 sites identified so far, and how much extra capacity will these sites add in terms of Type 2 sites, and how will they be secured?
That's a great question. We will identify those sites once we have final approval on each of those sites. Last week there were about 6. There are additional sites that are being looked at. These sites range from around 50 to around 100 patient capacity each. So these are much smaller incremental additions, but this plan allows us to grow as we need to grow. We don't need to open up a 1,000-bed facility necessarily if all we need at this stage is 50 or 100 beds. The other thing about those type 2 sites is they're already geared towards providing health care. They have the infrastructure, they have power, electricity, the facilities are set up to house patients, they have beds and oxygen and those sorts of things. So it's much easier to turn those on than it will be to turn on a large facility. But having said that, we do have plans for those large facilities as well if we need them.
Great, thank you. And now a question from Fox 7 for Mayor Adler. Yesterday in a work session, you were told unemployment could hit 25%. What is the City Council's response to this?
Well, there's no question that in addition to this crisis, health crisis because of the virus, there's an economic crisis in our city as well. And 25% of people out of work is a horrific place to live in, but that's where we live right now. So the city is focused on trying to bring as much relief as quickly as we can to the people that are out of work. That's why we've adopted rules and entered orders that won't allow foreclosures to move forward. That's why we've made it so that there'll be no turn-offs of utilities, water or electric. At the City Council meeting that we're having this week, we're putting about $46 million of effort into increasing the assistance programs for utilities. Also on the agenda for the council this week is going to be trying to bring direct support for those people that are really hurt the most and have the least measure of social safety net to support them. But the city, and I know the county is as well, is taking a look at all the social service programs that we have and trying to direct them to the people that need it the most. For the people that are out of work, I would urge you again to call the Texas Workforce Commission. Our area code, most people at 512, means that we get priority for calls from our area on Monday, Wednesday, and Friday between 1 and 5. And then Workforce Solutions is our county and our regional site. They actually have jobs that are posted and available right now for people. But that's a really good site to check to get support as well.
Thank you, Mayor. Next question is from Austin Chronicle. Will the ACS sites be delivering care for patients with conditions other than COVID-19? And how will patients be triaged to determine where they get sent?
Great question. So the alternate care sites are really designed to take care of low acuity individuals. So this may be individuals who just need supplementary oxygen, individuals who need IVs, or low levels of care. We're really going to focus those that need high level of care in the hospitals where they can better manage those individuals.
Great, thank you. And now a question from KView. Can you give us any more information on the clusters of COVID-19 cases?
So that's a great question. When we talk about clusters, what we mean is we have more than one case that is associated. That may be associated with an individual, it may be associated with a site. So, you know, one that everybody knows about is the cluster related to the spring break trip. So we have 8 of those right now. I would imagine that number is going to increase. This is a process of identifying individuals in a common area that they may have been exposed. We have some clusters that started at 2 individuals and they remain at 2 individuals. We have other clusters that have grown. We won't be providing specific details about those clusters other than to those who may have been exposed or who need to self-isolate as a result of their involvement potentially in those clusters.
Great, thank you. Question from Community Impact News for Mayor Adler. The isolation and protective lodging facilities housing quarantine patients and homeless folks will serve them 3 meals a day for up to 4 months. What's the exit plan for those experiencing homelessness when the lease is up? We're already short on shelter space. Will they just be moved back to the street?
We don't have really good exit plans right now from the virus, but I'll tell you the work's already started in getting that done, not just for exit planning for the folks experiencing homelessness, but also the exit plan for the community more generally. how do we move away from where we are right now? My hope is that we'll take advantage of a lot of what we're learning right now in terms of new technologies and new opportunities that we've opened. You know, we were on a path to provide hotels space, to try to provide places for folks experiencing homelessness. I'm hopeful that some of those facilities will stay on. That's consistent with the approach that we were trying to bring on. You know, that's a challenge that this community has had for a long time, and my hope really is that on the back end of the virus issue, we will have taken some real significant steps toward better taking care of this part of our community, better putting them in position to be able to get reincorporated into life. So we don't know exactly what that plan is, but my expectation is that we will not go back to where we were before, but we will start out in a better place.
Thank you. This question comes from KUT. How confident is the city that these additional facilities will also have enough PPE and ventilators in the event that they are needed?
You want to address the surge question?
Our surge plan is actually a plan looking at the 5-county region, so we are looking at the need for ventilators, personal protective equipment, medical staffing and whatnot for the entire region. We feel confident that if we organize our surge plan to the 50th percentile, that we will be in very good shape. We do need to slow down the advent of the surge in order to be in good shape. We have located significant stocks of face masks and appropriate medical and N95 or N95-like masks. Locating them is one thing. Then you have the logistics of getting them here and getting them appropriately distributed across the entire region. We have excellent task forces through Austin and Travis County's Public Health Partnership that also partners with the surrounding counties as well as the state in looking for the appropriate equipment, whether it is a mask, a gown, a ventilator, or even hand sanitizer. These efforts, the medical surge plan is looking at our medical care, but we also have significant logistical task forces looking at the same kind of personal protective equipment, both in the private sector for those essential businesses, as well as in the government sector, where government workers may not be in the medical field, but they are nevertheless essential critical infrastructure. So we feel confident that we will be prepared. But we can all do our part by reducing our non-essential activities so that we have more time to get that kind of equipment in the appropriate hands.
Great. Thank you, Judge Eckhart. This next question comes from Austonia. How many people are currently staying in isolation and protective lodging facilities, and who is staffing those facilities? For example, is it city employees, hotel employees, healthcare workers?
So the isolation facility has a combination of employees. Obviously, we have hotel employees that are supporting the effort. We also have some of our city-county employees who are involved in coordinating and ensuring that those individuals have appropriate social services and psychiatric support as well. We've got, in the isolation facility, there's around 24 individuals right now. Again, every time we get a confirmed case, our epidemiologists and APH nurses are contacting those individuals. They're offering them a spot at that facility. And again, we hope that as the situation grows, we'll continue to be successful in encouraging folks to convalesce or to recover in the isolation facility where they can protect themselves, protect their families, and protect the community.
Great, thank you. This next question comes from the Statesman. Can you explain how the area's testing capacity has grown over the past couple of weeks and how we expect it to grow in the future?
Certainly. So we've been running drive-through testing for a number of weeks. This is in association with our partners at Baylor Scott & White, Ascension Seton, and St. David's System, who help staff those drive-through testing sites. There are additional sites through community care, through Baylor Scott and White and through the Dell Medical School, as well as some private entities that are offering testing as well. The weeks have seen additional private entities adding testing. Some of those are the nasal swab testing or the PCR testing. Others involve testing antibodies. And while we see this new antibody test coming on board, we're working together to identify the best strategy to utilize that antibody testing. It's not really effective at screening individuals who we need to determine if they're infectious or not, but there is a role in detecting immunity. So we're working together with our partners in order to achieve that goal. Additionally, we're aware that the Abbott Rapid Test, that 15-minute test, is arriving in our community as early as this week. So we'll start to see some of the hospital systems start to be able to offer that test for their hospitalized patients. And this is critical because, you know, as this goes forward, we're going to have more and more individuals who are there's some concern for having COVID-19. And knowing quickly whether they have it or not is really important when we decide who needs an isolation bed or not. And that rapid testing is really going to help make timely decisions for those hospitalized patients.
Nikki, we're
Thank
going
you,
to do
Dr.
2 more
Escott.
questions.
Sorry, what was that?
I said, Nikki, we're going to do 2 more questions.
Gotcha. Okay. One of the charts shows the peak hitting in July or August and beyond if we do reach that 80 to 90% reduction in activity. Does that mean that all of our shelter-in-place measures will need to stay in place until then? And what is our ventilator capacity at the moment?
So the ventilator capacity right now is about 755. So, and again, as the mayor and judge mentioned, we are continuing to work to identify new sources of ventilators, including some that have been invented locally here at the Dell Medical School. As the judge and mayor also mentioned, this is why we have to continue this effort of stay home and work safe as long as we can. We have to continue the efforts at social distancing, the efforts at personal hygiene, washing your hands frequently, avoiding touching your face, the masking in public. All these things are critical for us so that we can prolong that peak as long as we can, so we can get that testing in place, we can get that PPE in place, we can get the equipment in place, so that when we do face increases in cases, we are better prepared to manage those. I'll say that also, it's not clear what the long term looks like for this virus. It seems unlikely it's going to disappear. That's just not going to happen. So we're going to have to face this to some extent at some stage. Our preference is to take care of patients a little bit at a time, to never exceed the capacity of our healthcare system to take good care of those individuals. So if we can do that, we can fight this battle for a long time. We can ensure that we are saving as many people as we can, but that delay also helps us to identify 2 things. Number 1 is an effective treatment that will work in this illness. The other thing is a vaccine. So the longer we can push off the peak, the better prepared that we're going to be to respond effectively and care for people.
Thanks, Dr. Escott. Last question, I believe. Is the city considering increasing enforcement of stay-at-home orders? When can we expect to start seeing citations if people continue to violate those orders that are already in place?
I'll ask Mayor Adler to take that question.
You know, the rules we have in the order are enforceable both by fines and by putting somebody in jail. But we will not be able to enforce our way to compliance at the level that we need in this city. This will only work to the degree that each one of us individually decides that we want to answer the question that the county judge put forward at the very beginning of this. You know, how badly do we want to take care of people that are living in our city, in our county? How much do we want to save lives and lives that we don't even know about? How much do we want to save our grandmother and everybody else's grandmother? You know, we can do the enforcement, and we do the enforcement in order to remind people what they need to do. But at the end of the day, we're going to have to be enforcing this by agreement between each other. It's going to take everybody making that individual commitment that adds up together to be the cumulative decision. And frankly, that's what we're watching right now, and we're seeing a lot of that on our streets right now. We're seeing a lot of people, most people, that have participated in this. We have some riskier moments and elements which we're going to try to address. But at the end of the day, we're gonna swim together in this. I believe in this community. I believe in the people that live here, and that's why I have such a sense of optimism and hope, because I know that collectively we can get this done. And with that, I think those are all the questions. We appreciate staff setting this up and making this go. I also want to thank the first responders that are out putting themselves at risk for the rest of us, the people in the healthcare industry. I want to thank the economic first responders, the people that are manning the grocery shelves and stocking those shelves for us. We're all in this together. We just have to especially thank them, especially while it's National Public Health Week. Thank you.
Thank you so much.
Will Dupree once again in the KXAN Live studio. You've just seen the wrap-up of a press conference involving the mayor of Austin, Steve Adler, Travis County Judge Sarah Eckhart, and the interim health authority for Austin, Travis County, Dr. Mark Escott. Quickly, I want to show you all one final thing before we wrap up this press conference and this stream. If you take a look, these are the latest numbers that have been shared by Austin and Travis County related to the COVID-19 pandemic here and what impact it's had in our particular area. Once again, these are the numbers they've just shared a few moments ago, and we have a few more to be able to look at now and to kind of gauge the impact that this is having on our community. So right now there are 554 positive confirmed cases of COVID-19 in the Austin, Travis County area. 7 people have died so far. 77 people have been sent to hospitals, and 28 people are now on ventilators because of COVID-19. Again, these numbers came just a few moments ago at the beginning of this press conference when Dr. Mark Escott, the interim health authority for Austin, Travis County, shared those with us. We also want to point out that the city is going to be closing all parks, trails, greenbelts, and preserves starting at sunset on Thursday. So tomorrow at sunset, they will close until Monday at sunrise, and that is because it is Easter weekend, so a lot of people will be wanting to go out and enjoy time with their families, potentially going on the trails or going to the parks to take in the nice weather if we have that at that time. However, they are taking these actions to prevent people from going to those spaces and ignoring the social distancing requirements and recommendations that are out there at this point. This is in an effort to protect people. And I don't know if you caught it or not, but the mayor said that, yes, the parks, trails, preserves, and greenbelts will close for Easter weekend, but he also said during that press conference that it may have to be extended well past that to protect people. That, of course, is something that we'll keep following as our reporting goes on, and we need to ask the mayor some more questions about that, because there may be additional action that will be taken to keep all those public spaces closed so that people don't congregate and gather in big numbers and put themselves at risk. Once again, I'm Will Dupree here in the KXAN Live studio. You can find more of our reporting on KXAN.com and the KXAN News app. Those are really great resources. Please download that app on your smartphone if you don't have it already. Thanks again for watching, and we'll see you back here another time. Please stay safe, healthy, and if at all possible, right at your own home. Thanks again, everybody. We'll see you back here later.